Okie dokie. So welcome everybody to the session that we are hosting today via a nifty Teams webinar event. As you no doubt have seen in the invitation, that today we're going to be talking about how to thrive in the era of AI with Microsoft Copilots. So just as a heads up for everybody, the session is recorded and recording has already started. So bear that in mind if you are going to try and contribute to the session. For anybody that joins late, we will make the recording available to everybody who was invited to the event. We'll start as a bit of an introduction as to who you're going to be faced with here at Velrada today. And my name's Jordan O'Halloran. I'm one of the sales directors of the organisation. I've been with the business for about 6 years. And I'm joined by a few of my esteemed colleagues who, fortunately for you guys, will be doing the majority of the talking for the session today. Jared?
Yeah, good afternoon, everyone. Jared Eischen. I've been working in the Microsoft space for over 15 years. As one of our lead solution architects here in Velrada across the Microsoft Cloud for Healthcare and Dynamics 365. Matt?
Hey folks, Matt Pontel. I represent our Power Platform and Modern Work application practice here at Velrada. We're the team that comes in with a UX focus, human-centric focus, working with many different facets of healthcare to deliver Power Platform solutions. And Eric.
You're on mute, Eric.
Sorry, guys. It always happens and adds a little bit of comedy. Eric Pele, I lead our health practice over at Velrada. Spent my life in the health and health tech space and excited to be a part of this discussion. Thanks, Jordan. Back over to you.
Cheers, Eric. So just as a bit of housekeeping, like I mentioned, this is a Teams live event, which some of you may have used in the past, but if you haven't, there are a few features in there that you might not have seen. So there's both, just to make things confusing for everybody, there's both a chat and a Q&A feature within this meeting. There's subtle differences between the two. We will do our best to monitor both. Effectively, if you post something into the Q&A, effectively acts like a Twitter post, where people can comment and it sort of holds its position within a feed. Chat, hopefully you're all familiar with how Teams chat works. If I had a preference, I'd prefer you to pop stuff into the Q&A so it's easier for us to monitor and try and come back on. But yeah, genuinely, you can put it wherever you like. Just to make things even more confusing, I'm also trialing today a brand new preview version of Microsoft Teams. So hopefully that doesn't put me off or cause too many distractions, but bear with me if there are any issues. You may have picked up that the audio is coming through my colleague Matthew's machine, who's sat here next to me in the meeting room that we're in. We're over in Western Australia, so just if that is confusing for you all, there's no magic here. It's just that I'm using Matt's audio. Just to kick things off, I'd like to acknowledge the traditional custodians of the land throughout Australia in which we're all residing today, and pay my respects to their elders past, present and emerging. We've got a fairly jam-packed session for us to run through today. The first 3 bullet points, I'll be sort of taking the helm for giving you a bit of an introduction as to Microsoft Azure OpenAI and how that exists within your ecosystem, the copilots that Microsoft have enabled within their product stack, and then a point of view on how you might be able to leverage that within your industry. But we will try and get through that really quickly so that we've got the most amount of time in this hour available for us today for live demonstration. So you're going to see some of these Copilot features in action. And that's where we're going to spend most of our time. We will try our best to reserve some time at the end to answer Q&A, and we'll obviously be monitoring that as we go. But of course, feel free to reach out to your Velrada rep, myself or any of the people on the call today, if you've got any questions or if you'd like to know more about any of the content that we're sharing. So just as a bit of an introduction for anyone on the call that hasn't met Velrada previously, we're a little over 250 people. We're a Microsoft Gold partner, and we specialize in the delivery of Microsoft solutions alone. We span the end-to-end Microsoft Cloud Platform, but with a particular emphasis on business application-led digital transformation. And so you're going to hear the term business applications bandied around by myself and my colleagues today. What we mean by that is capabilities from Microsoft that either live in the Dynamics 365 ecosystem or in the Power Platform ecosystem. And look, if you don't drink the Microsoft Kool-Aid already and know what those terms are, hopefully you'll get a bit of exposure for it in this session. And of course, we're always happy to provide more information. So we've been in operation since about 2009. Australian headquartered organization, but now with truly global operations. We've been fortunate over the last couple of years to pick up a number of awards and accolades for the work that we've done within the business applications ecosystem. And largely that has been on work that we've delivered within the healthcare industry. So there's plenty of literature up online about some of the innovative solutions we've been able to work on with some of our customers. And so hopefully you'll get a bit of a feel for that today, and always keen to talk through it. So just as a cement that claim to fame, last year we picked up the Australia New Zealand Business Applications Partner of the Year. And we also were finalists globally for the work that we've done with Dynamics 365 Service and Microsoft Mixed Reality. And one of the sort of main solutions that we delivered that led us to that award was a solution we delivered for a regional health service in Victoria that involved the leveraging of Dynamics 365 and remote assist HoloLens capabilities. So great to see that healthcare is being the driver for such global recognition. So I mentioned that we've worked with a lot of healthcare organizations. I thought I'd give you a bit of a frame of reference for the types of businesses that we've worked with. We've got experience through complex enterprise public health scenarios, right through to large community organizations and through to really specialized health offerings in mental health or physio and allied services. So a bit of a plethora of experience, all of them really revolving around how Microsoft business applications can be leveraged to transform the way that these organizations operate. Now, today's session is not about Velrada, it is about the age of AI. And so you probably all agree that there's a large buzz in the market, not just the technology market, but all markets around AI. And lots of claims to fame around the importance of it and the impact that it's going to have on the way that we operate and do business. It leaves me to sort of be excited and somewhat daunted about how we can leverage these capabilities, but also with the question, why now are we seeing an emergence and an excitement around all of these AI technologies? And so I'll give you a bit of a flavor for what's changed. So as you may well have seen in the media or hopefully already used yourself, there are solutions out there like ChatGPT, which are really hailed as large-scale foundation models, which are underpinning the, I guess, the excitement around how we can leverage these capabilities in the way that we operate. And so you've got you covered from image processing through to language processing and natural language processing, which is largely what you're going to see in action today. Now, Microsoft have invested heavily in OpenAI, and you probably saw all of that out there in the media. That partnership has provided an opportunity for all Microsoft customers to leverage these OpenAI capabilities within the confines of their Azure environment. Now, I'm not a technical specialist, so I won't go too deep into this, but I wanted to give everybody a point of view of what does that mean for you and what is your opportunity to make use of these OpenAI solutions. So effectively what Microsoft have done through hosting these capabilities in Azure, they've weaved them into the tapestry of the products and services that they provide. And so you as a Microsoft customer, it's highly likely that you currently leverage Azure for identity management or security and governance of your organization's data. The OpenAI solutions are available within the confines of your Azure tenancy. So this basically provides a bedrock for you to call these services and these large language models directly within the the structure and safety and security of your Azure tenancy. And you can therefore use that in all of the line of business services that you already buy from Microsoft. So just to, I guess, make things clear, what that really means for you is that your data is still secure and stays within your Azure tenancy. It's your data and remains your data and is not leveraged via Microsoft or OpenAI to train any of the models. So the security and governance policies and procedures that you have configured within your Azure tenancy remain and true and hold strong against all of your operations within the use of Copilots or any of the Azure OpenAI services. So we talk about Copilots, and I think from my point of view, it's good to understand what we mean when we say Copilots. And so what Microsoft have effectively done is thought about the ways in which OpenAI services can be leveraged within the products that they provide to you guys as customers. And rather than try to replace any of the humans within our operations, what they're really trying to do with Copilots is augment the people that we have in our organization, and emphasize the skills that are native to and unique to our offering to business and to healthcare as humans. So allowing us more free time to focus on innovative tasks, use the skills that we have that aren't natural necessarily to machine learning algorithms or artificial intelligence, like empathy. And what they've effectively built is a suite of these services that they call Copilots. And so there's a broad range of Copilot features that are available to Microsoft customers. I think we're currently sitting at about 155 different Copilots available within the business applications ecosystem, and that is ever changing. And so these Copilots are here to augment what you do on a daily basis, and that might be reducing administrative tasks or providing insight and knowledge to frontline workforce, and you'll see some of that in action today. So I mentioned there are 155 Microsoft Copilots at this point in time, and they're available throughout each of the Microsoft business application services that you can prescribe to. So they've got you covered from patient engagement right through to the way that your organizations operate, and indeed into bespoke solution delivery. You'll see on this slide there's a list of capabilities that you might look to leverage if you're operating within the healthcare environment, and we'll give you a bit of a flavor of how you can use those today. So I just thought I'd sort of finish up my section of the session honing in on the four pillars that we see as being most instrumental within healthcare for the use of Copilot. So these are compounding knowledge, scaling innovation, optimizing your operations, and improving decision making. And you'll start to see some of these come to fruition when we get to the demo section of today's content. But for me, compounding knowledge is an area that I'm super excited about. When we talk about compounding knowledge, what we're effectively referencing is the ability for knowledge, both within the organization and external to the organization, being able to be processed by these large language models and disseminated out to your frontline staff wherever they need it. And so for me, the ability for us to be able to process policies and procedures and guidelines and deliver that real time in the form of a chat-based interface or a Power Virtual Agent is super exciting. And you'll get a feel for how we can do that with relatively low code in the demo section for today. But equally, you can optimize the way that you operate. And so you'll see when we get to the field service demonstration how we can recap the work that we've performed. So if you're a clinician who has provided service perhaps we can save some administrative time by creating a recap for the work that's been performed, the care activities that have been undertaken, and store that in your electronic health record system, or indeed the Microsoft Cloud for Healthcare. And then furthermore, if you were looking at how you could leverage these capabilities to engage with your patients, there's a whole world of exciting possibilities with regards to the use of virtual agents and AI-enabled telephony for you to be able to automate some of the administrative burden of that potential early engagement with clients or patients, and then maybe some of those follow-up activities. So I promise I'm finished in a moment. What I sort of want to land on is that there is so much change within the world of AI, and I've been truly staggered by the rate of change that Microsoft have been able to offer us all over the last 6 to 9 months. I first started having conversations with them about 9 months ago around where they were heading with OpenAI. And getting a feel for how we could best position ourselves to take advantage of the Copilot suite. And from 9 months ago to now, it's absolutely breathtaking, the rate of innovation. You're going to see a smidgen of what is available for your consumption today. And all I'll say to everybody is that the rate of change is so prolific that if you've got an idea for how you could leverage AI within your organization and it's not already available or listed out there in the documentation as a feature, you can almost bet your bottom dollar that it's coming. And so reach out to one of your Velrada contacts or indeed your Microsoft account team. Ask the question because it may well be on a roadmap and coming to a system near you very soon, or indeed something that we can extend with some of the opportunities that you get in Azure to customize these Copilot AI models. So I'll pass over to Jared, who will jump straight into giving us a bit of a demonstration.
Thanks, Jordan. And thanks, everyone. Let me just get to the next slide here. Fantastic. So as Jordan mentioned, there are well over 150 different Copilot sort of features or capabilities. We'd be here all day and probably multiple days if we tried to show all of it. So we're going to hone in on 2 different scenarios. The first being around how Copilot can help manage appointments, and the second being around how Copilot can help you and your staff find the right knowledge in order to support your patients, your clients, or consumers, and use that to then engage them in a more effective and efficient way. For those of you that have not seen the Microsoft Cloud for Healthcare or Dynamics 365, you're in for a treat. And for those that have, it'll be pretty familiar. We're just building on top of the sort of standard capabilities and power that Dynamics brings to your organizations. So let me just share my screen here. Give it a sec to pop up. So what you're looking at is Outlook. I'm going to start my day off, like many of us do, is going through emails that have come into my inbox and working through the tasks that I need to respond to. In this particular instance, I've got an email from Graham. He needs to reschedule an appointment. So traditionally, I'd have to switch over into our Dynamics 365 system or EMR or some other system, and then figure out where that particular appointment is, and then go ahead and reschedule that. Maybe I have to call Graham. It's potentially a process that could take as little as just a few minutes to maybe a bit longer. So I'm looking at one of our instances for the Cloud for Healthcare here. Again, I might start my day off, as a particular role, in this case, a care coordinator, looking at different care plan activities and other additional stats and charts around care plans that I'm managing. Knowing that I have to respond to Graham here, though, I'm just going to quickly search for his record. And I can search by name, by email. I can search by his Medicare number, any other sort of identifier that we have around him. Now, pulling up Graham's information, we get an excellent sort of summary of who Graham is in context of our health organization. Information around his conditions, information around relationships that he potentially has, as well as upcoming activities and other alerts that I might need to be aware of. Now, knowing that I have to go manage this appointment and reschedule it, I have to go find that appointment. I might go down here and look at potentially the services and episodes of care that we're delivering to Graham and figure out, which one is relevant. I might go through our clinical timeline that we have for Graham here and find that particular appointment and reschedule that directly from here. Or from an operations standpoint, I might go to the calendar for this particular service that we're providing and manage that from our schedule board or calendar view from here. But what Microsoft is doing is bringing Copilot and that experience around appointments and visits into the front line or into the manager's view within Outlook. So they can do that directly from here. So I'm going to open up Copilot, and Copilot is going to connect to our system. It's all working together, and it's going to figure out, okay, what is this email about? Who is this email from? And then suggest to me, potential actions. First thing it's going to show is, from a work order or appointment standpoint, work orders are more advanced appointments in our system and our terminology. I can create a new work order or appointment directly from here. But it's also picked up that this is related to an existing one. So given that this is, a request to reschedule, I'm going to go ahead and select that existing one, and let's go ahead and take a look at that. I can see some stats around, status, priority, again, who it's from, and then what type of appointment this is. So it's a home visit, and there's specifically a needs assessment for occupational therapy that needs to happen. And some information around Graham's finances is available there. And then when did we actually go ahead and attempt to schedule this? Looking at the email, Graham's only available Thursday after 1 p.m. So I'm going to change this initial time from, I think, Wednesday to Thursday, and then we'll just change the time real quickly to 1 p.m. and then we'll go ahead and save that. What's going to happen is that's going to sort of reload, and then we're able to actually go into the sort of scheduling view of this and get Copilot suggestions on who might be the best person to go send. So in this particular case, based on this being an occupational therapy needs assessment, based on Graham's location, based on any other scheduling rules and details, Copilot is suggesting that Ashish is the right person to be there, and is actually available at 1 p.m. And the way we've set this up is that he's got 16 minutes to travel there from his previous appointment or his location at that time. So he'll arrive right at 1 p.m. if we want to book that in. So again, Copilot's helped us very quickly identify the right appointment, and it's very quickly helped us identify the right resource to reschedule this and action this. This demonstration only lasted literally like 30 seconds, 60 seconds. But if you consider how much time it might have taken before, add that up over the course of a day, a course of a team, a course of a month and a year, saving just a few minutes here, which is what Copilot's done, can provide a significant advantage and value add for our organization. If I wanted to expand this further, though, and potentially dig into the details of this appointment before I go ahead and reschedule that, one click away, we'll launch into that appointment within Dynamics 365 here. Again, I see all the details that I saw on the summary screen directly within Outlook, now within Dynamics here. And I see that same booking suggestion. Again, I can just go book. But if I wanted to take a look at what other details might be relevant, such as the products and services that are required for this appointment, I can do that. I can look at the different tasks that we might need to perform, once we actually get on site. And I can look at, what are the sort of knowledge information is potentially relevant to this. Again, Copilot suggesting a lot of this for us. So in this particular case, knowing we're going on site, we might want to, refresh that visitor, that carer's COVID testing procedures for them. And then from there, I can use that information and then go ahead and book, Ashish. You'll also notice this pane here, Copilot Preview. I can click Generate there. What this is going to do is give us a summary of this visit and give us a summary of additional information around Graham and his conditions and medical information that might be also relevant for me as I manage this appointment. So in this particular case, notice that Graham's got an NDIS package requiring OT and home care services. Graham's case is deteriorating. That's interesting. I didn't actually notice that before. So what Copilot is doing here is looking at some of the progress notes and information that we have from Graham from a clinical standpoint and bringing that in because, if I'm going to go visit him, I might need to know about that and know why. So I can dig into that a little bit further. I also get some additional information around, that their previous appointment was canceled. So again, Copilot's looking across everything here to help summarize this information and help save time for us. So again, I can just quickly book that, and then there we go, we're done. Now I'm going to switch over to another view here in context of maybe more of a help desk user, someone that's not only managing emails, but someone that's managing phone calls, chats. We're going to use what's called our customer service workspace environment, which brings all that together into one experience so you can engage your patients, engage your external providers from one solution. I've got that appointment, that reschedule appointment here. Just collapse this so it's a little bit easier to read. I also noticed that I've got a couple other emails that I need to go look at. So I'm going to open up this email also from Abigail about oxygen batteries and travel. So Abigail's traveling to London, 15-hour flight, inquiring about how many batteries she'll need for her portable O2 concentrator. Couple of different ways that I can approach this. I can just go ahead and click reply directly from here, and obviously type out a reply, send out an email. Great. What you'll also notice is as I click reply, over on the right, Copilot's has intuitively discerned that I'm responding to an email. It's opened up this write an email pane for us, and it's going to potentially help us respond to this particular email. And I can give it some prompts to potentially suggest the type of email that I'm trying to generate. In this particular case, I have enough information. I can respond to Abigail. I don't need to actually get on a call with her. But if I did and need to understand a bit more, I could suggest a call, request more information, or click any of these other prompts or describe a prompt that I want to start with. In this particular scenario, I'll click resolve a customer's problem. And what's going to happen is Copilot is going to look at the email. It's going to look at Abigail's record. It's going to look at the knowledge that we have within our system and the knowledge that we have across our organization, and suggest to us an email to respond with. So literally within one click, you can see there's a pretty robust email here that takes into consideration everything that Abigail's requesting, has looked across our information and our knowledge to suggest some content that we can respond with. And one click away, I can copy this into the email and then go ahead and click send. But before I do that, I might want to review this, make sure it's everything's accurate, but also potentially look at this particular paragraph and say, hey, wait a minute, that's really long. There's quite a lot of information there. Is there a way that I can shorten this? Now I can adjust this particular paragraph that Copilot has generated. I can make it a little bit shorter, and I can change the tone of this email or this paragraph. So let's make it a bit more friendly, and let's go ahead and update. And so Copilot's going to take that and just revise that again a little bit further for us, and then we'll be able to send that out. So there we go. Just delete that additional hi there, and it's changed that a little bit for us. So got a more friendlier tone and shortened information. The next thing I'll show as part of this is, we've got another email here. And this particular email, also from Abigail, our demo person. In this context, she's the primary carer for Graham. She's looking to cancel an upcoming visit because there's been a death in the family. So, looking at these particular prompts, obviously we don't want to suggest a call. We could just resolve the problem, but we also want to use Copilot to potentially respond in a more empathetic way, which is certainly much more relevant from a healthcare standpoint. So by selecting that empathize prompt, I can easily get an email again generated by Copilot with that more empathetic tone to it. I'm sorry to hear about the recent death in your family. We'll basically manage this, pass your complaint requests along. So this is all reviewable and editable by your users. So you can tweak anything before you actually go send it off and respond. Okay. So a couple different examples of how we can respond to these emails using the generative capabilities that Copilot is providing. If we're not getting the information we need, we can always ask Copilot to help us and ask just really any sort of information or question to get information from Copilot again, based on what we have inside of our systems and the knowledge we have across our own organization. So if I needed to ask, how do I create a care plan? Copilot's going to look up that information and help me get access to that. I can look up, really any sort of other information around, recent policies and procedures, or other ways, we need to manage an appointment or manage, a particular client or patient's request. Fantastic. So I'll share the deck one more time. Should pop up here, and then we'll get back to this. So with Copilot inside of Microsoft Cloud for Healthcare and inside of Dynamics 365, everything you've just seen there is point and click, turn it on, just a couple checkboxes. There's no code that needs to be written. There's no, massive amounts of services and deployments that need to be done. It's all available just through your administration and turning on these capabilities. You can select, if you want the Copilot to tap into your knowledge base system, that's within Dynamics, that's within your SharePoint, or other, potential sources within your organization. As Jordan said, and we will touch on a little bit later, this is all your data, all secure. Everything that you've seen here around how we respond to Abigail and Graham and all this important information around their clinical data is all within your tenant. It's not going out to any other AI services that other customers are using. And you've seen just, a couple of different examples of, business scenarios. There's a breadth of what we can actually do, and we can build significant amounts of capabilities and that Copilot can help with from, your specific processes, requirements, and use cases. With that, I'll hand it off to Matt, who will touch on that.
All right, this is where we get to see a little bit of how we build some bespoke solutions, whether they be back of house, whether they be front of house, using the Power Platform. And the Power Platform is some of the technology that underpins some of what we've seen here with Dynamics 365 and the cloud for healthcare. It's everything that might be bespoke to your organization, maybe some business processes, maybe the way in which you want to be able to interact with patients, or other vendors that you might be working with as well. Just going to take control of deck. There we go. So one of the questions of why Power Platform for healthcare? Look, I'm not going to go through each of these examples, and this is just a vague list of how we have seen the Power Platform used in healthcare, knowing that's a very broad stroke, and thinking how I interact with my healthcare providers, trying to reschedule an appointment with an endocrinologist, or trying to find just the next available GP appointment, trying to ask questions about a medical device that I might need to travel with, and how it might be able to go through airport security, all the way through to being able to analyze data that has come from test results and being able to look at that over a period of time and have that knowingly, securely available to me, and also through my HCP. These are some of the ways in which we've seen the Power Platform leveraged. But to be able to build these solutions doesn't require months and years worth of writing code. We're talking days, we're talking weeks. It's a very different time scale. And what I want to be able to show you today is a couple of different examples, and we're going to use prompts, and we're going to instruct the Power Platform to build a solution. Now, will it build the solution in its totality and it completely everything we want of it? No, absolutely not. It's going to get us 40, 60, 80% of the way there, depending on what it is that we want to build. It's allowing us to accelerate, providing that we give it a good prompt. So I'm going to walk through what you're about to see in a demo. Here is an example where we might build a Power App. And I want to try and talk of back of house, because a lot of healthcare organizations say to us, look, the customer facing, that's all great, but we've got a spreadsheet, or we've got a piece of paper that gets passed around, or we've just emailed someone to say, hey, we're out of supplies. We want to try and create a system around that. We want to try and demonstrate control and have that be a little bit more organized. So we're going to build an app in a matter of minutes to help us track drugs, medicines, supplies, PPE that we have within our clinic. We're also then going to show how that we can use natural language to then modify or update that particular app as well. If I'm not a developer and I want to generate this app, how do I use English to be able to add some extra features to that app before it's ready to deploy? We also want to explore Power Automate. This is our way of saying when we notice something occur, a trigger, we want to be able to automatically perform these actions. And going back to our previous example there, we want to be able to see, well, if something is low in stock, I want to be able to send an email so that we can actually start to get the ordering process started so that we can get that stock back up to the appropriate level. So I'm going to flick over to my demo screen here. Now, this is live. This is a real Power Platform environment. And if you've got a pen and a piece of paper next to you right now, this is what you want to type in or write down to try later, make.powerapps.com. And if you type that into a web browser, and if you have access to the Power Platform within your organization, you can start building apps exactly like I am today. So I'm presented with this little screen here that says, let's build an app. And I have that prompt ready to go where I want to say, I want to track supplies. Each of these items is going to have a type, a name, a minimum stock count. What I've just observed is the current stock count and a storage location. I'm going to click go. Now, under the hood, what's happening here is it's interpreting what we've said. It's using GPT-4 to interpret what I've said, what those requirements are, and it's going to match that to what it thinks we need from a data model perspective and from a Power App perspective. So quite quickly here, we've seen that it's looked at my requirements. It's going to create an ID. It's going to create a name, a type column here. We can see here it's suggested a bit of data, and you know what? This actually looks pretty good. I'm going to say I want that type column to be a drop down. I want it to be free-form text. And I want to be able to pick that from a list. So let's see how it interprets that. Again, GPT-4 is interpreting what I've said. It's mapping that to a list of potential actions. And there we go. You might have noticed just that little icon's changed. That's now turned into a choice. It's turned into a drop down. And I'm pretty happy with that as a first pass. So I'm just going to click on Create App. And what that's going to do is it's going to go through that recipe of steps that you might have seen down the bottom left-hand side there. In creating the data model, it's going to try and interpret what does this need to look like from a Power App perspective, a mobile app or a desktop app that someone can have on their device that they could use to take stock of what we might have in the cupboards, the fridges, the PPE store. And that's going to generate an app. Now, again, it's not going to be 100% ready for production. It's not going to be 100% ready for use. But it's going to get us a lot of the way there. So once that finishes loading, we're going to see that we are in the Power App Editor experience, which is a drag and drop and low code way of us being able to build an app. And we've got Copilot here to help us do anything in addition to what it is we might need to do. And I'm just going to take a risk here. I'm just going to click play. I'm just going to see what this app looks like. And very quickly here, we can see it's given me a couple of different options here. Maybe it hasn't quite landed what the labels need to be, but that's okay. We can change those, but we can see and we can go in and let's say there's a particular type of medical supply, drug D. I can edit that and I can say, actually, our current stock count is now 20, and I can save that. And then we're going to be able to realize, doing a stock take that we are now below that minimum. We're going to do something cool with how we trigger a warning for that a little bit later. But let's say I just from this app want to create an ad hoc email that goes to the manager to say, hey, look, we are critically low on something and I need to tell you, or there's something brand new that I think we need. I'm just going to use a prompt over here. I want to add an email screen to this app. So clicking on that, what the Copilot's going to do, it's going to think of, well, what does an email screen need to look like? What type of fields would we need to use there? And just whilst that's thinking about it, it's going to create a brand new screen. We can see there, it's just created a screen. It's thinking about it. It's rendering what needs to go on that screen. There it is. It's created this brand new screen here where I can pick someone internal to my organization. I can add a subject. I can add a message. If we click on this button up here, the send button, it's actually on select of this button. And this is where we use Power Effects, low code. If you're an Excel guru, it's very similar to how you would write functions in Excel, where it's thought about the code. It's even added comments. You can't even get a real developer to do that sometimes. Which actually goes ahead and sends that email to the nominated person, resets the form, which is great. I just did that using, well, that was 4 words in Copilot. Now, is some refinement required? Yeah, probably, but it got me most of the way there. So the next thing that I want to do is I want to create an automation. I'm thinking that if stock is low, I need to email someone about it. So I'm going to go up here into Power Automate. Again, if you want to write something down and have a play this afternoon, make.powerautomate.com. I'm going to go up here into New Flow, and I'm going to say, I want to describe it to design it. I want to let the AI build it for me. And here is one that I've prepared earlier to say, when I update that tracking the stock tracking details in Dataverse where the data is stored, and I have a record where the current stock is less than minimum stock, I want to send an email to my manager to let me know that we're low on that item. So let's see how it interprets that. And much like asking AI, hey, look, I want something for dinner. If I want a good result, I'll say, I don't like rice. I would prefer noodles, and please add veggies. It's going to give me a better outcome, right? So we've got to make sure these prompts are descriptive, but it's suggested something here. And I can keep clicking try again if I don't like this, but when it notices that something's been saved, it's going to get my profile. It's probably going to check to see if it's high or low, depending on the minimum stock requirements. And if it is low, it's going to get my manager and it's going to send an email. Hey, that looks pretty good. Let's click next and let's create this. Let's just see what happens, right? Oh, perfect. So it's on this canvas here on a trigger where it's, I suspect that's when we save that record. It's going to find what we've saved. It's going to find out who I am. And the condition here is, it would be if the minimum level is less than what is required. It's going to get my manager. It's going to send an email, and I can even ask it, what does this flow do? Maybe I've inherited this, or maybe a colleague's given me this. Maybe I'm not really too confident in reading what I see here, but yeah, look, it's telling me what this flow does, and I'm able to interact as a non-developer with this, and I'm able to create business process and workflows pretty quickly and easily. So let's push the boat out to something that maybe is a little bit more customer facing, right? I want to create a virtual agent. I want to create a chatbot, and hello, I've created a chatbot called MedBot. But what I want to do is I want to create a workflow. Maybe I want to drop this chatbot on our website or in a patient portal, and I'm going to create a brand new topic of conversation with Copilot. I'm going to call this vaccine booking. Let's just be specific. This is for the flu vaccine. And I'm going to paste in this prompt, and basically it's saying a user wants to schedule a vaccine, collect some details, ask if they've ever had any adverse effects, and then let's try and find a time where we can make an appointment. So let's create that. So again, it's thinking about it. It's looking, GPT-4 is looking at the questions that I want to ask, and it's trying to figure out the right way to workflow this on the canvas that we see here. So it's figured out if we find a phrase like this, I want to book a flu vaccine or schedule a flu shot, reserve, it's found all those different synonyms that we can use for something like that. It's going to ask for some details. hey, look, that's all great. Let's just see if it works. Hi, Medbot. I want to book a flu vaccine, please. You always have to be polite. That's the running joke with AI. And it's going to say, what is your name? My name is Matt. Matt@test.com. And it's probably going to ask for a phone number. Let's give it one that looks real, because otherwise it will complain. No, I have not. And I'm thinking, whoops, there you go. Live demos are always fun. But we can see here that it has tried to build out conditions to say, you know, if I have had adverse effects, it's going to say, please consult with your healthcare professional. It's not going to let me book something. And if I don't have any adverse effects, it's going to go through and it's going to suggest some dates as well. And finally, what we're going to be able to do is show how we can create a patient portal, something similar to that, or add something to a patient portal. I've got a prompt here. It's going to be very generic. I want to create a site where a patient can fill out their details and health concerns on a single form prior to going to a medical appointment. And again, it's going to think about what I've just asked it. It's going to have a look at some examples of what it might be, and say, okay, look, patient form. Yeah, that's a great site idea, or name for that. It's going to give me some options for layouts. What does this need to look like? Hey, look, that one's fine. Let's just start with that. It's going to ask me what pages I want. Maybe this is just a form that I want to embed in an existing website that we've already got. Yeah, maybe let's just grab this one. This one looks pretty good. Just going to hit done. It's going to set up this portal site. It's going to set up that form. It's going to set up a table in which that data can be securely captured into. And maybe we might want that data to automatically integrate into our patient management system or health record system, or simply just notify someone at the front desk that it's been filled out. We could give this URL to someone using a QR code. They'd walk up, they'd scan it. We could email them prior to them actually coming into the appointment so they can pre-fill it. Again, try to make the patient experience just a little bit more vibrant than sitting down with a clipboard that someone else has touched and a pen that someone else has probably touched as well. So some of this does take a little bit of time to set up. I guess if folks have used the Power Platform before, if folks have seen anything they've liked here or have any questions, please pop that in the Q&A. Would love to hear about how you might have already used the Power Platform in your organizations to build back of house or front of house solutions. And this is probably the biggest one in terms of the setup. This is quite literally creating a web portal that someone could log into or anonymously access, theming it. If anyone is technical on this call, yes, being a web developer is not easy. There's a lot of boilerplate that this eliminates in setting that up across all of this. There we go. So this is going to open up the Power Pages Studio. And again, you go to make.powerpages.microsoft.com in your browser. Write that down, screenshot that. That's 100% something you should be able to type into your browser today. And it's gone, here's a home page. The Get Started button probably takes us to this page that it's given us. Maybe it's this one here, and we can see, well, here we go. It's just taken a bit of a guess. First name, last name, date of birth, maybe gender, health concerns that they might want to write in. Maybe we can say, and let's just give this a shot. Add an extra field to the form to collect the desired outcome from the appointment. There's like a text field. And we can see here, it's already got this little hide and show down here. So when they hit submit, say thank you for submitting. So that's really cool. It's thought about a couple of things, and I can give it our example of our corporate branding, and it will make sure that all the colors are right. I think it might have chosen this light green just as a nice dull tone for healthcare. But we see here it said, hey, look, I want to add this form field. It's just added at the bottom there. That's okay. I can always drag that to the top, and it's saying, are you sure that this is what you want? But it got us most of the way there, right? I didn't have to go click through a lot of screens. I didn't have to write any code. But if I did want to write code, I can click this button here and edit the code if I'm that way inclined as a web developer. If we can go back to the slides, if one of my colleagues wouldn't mind just putting those up really quick. Just a quick recap of what we've seen there, just as a real whistle-stop demo of how Copilot can help us build some applications, solutions in the Power Platform. We've seen it build Power Apps to help us manage some back of house. We've seen it build automations to respond to triggers and perform actions. We've seen it build topics for Power Virtual Agents. And I know that chatbots weren't smart for a very long time. I really implore you to reconsider and have a look at what's available today, especially with AI, safely being able to enrich it, building out portal functionality, external facing functionality, and just helping you manage your estate as well with the Power Platform. I'm going to hand over to my colleague now to go through some of the last details before we wrap up.
Thanks, Matt. So just to close off, we do get a number of questions from our customers. Some of the more common ones is, what do we need to license in order to leverage Copilot? And that really does depend on the Copilot that you want to use. Again, there's 155 plus different sort of capabilities. So if you're using some of the stuff that I showed within customer service of Dynamics 365, no additional licenses required, but you do need a customer service enterprise license. Whereas some of the Copilots that Matt has shown are available as long as you have app builder capabilities across the Power Platform. So come speak with us. We're happy to help guide you depending on the your use cases and the Copilots that are available. Copilot is available across a number of languages, English certainly supported. And then where is Copilot and Azure OpenAI available? So Microsoft is rolling this out globally. It is available in a couple of different countries right now. Australia is very, very, very close. We're speaking to the product team every other day. So it is coming to Australia very soon, and we can help sort of guide you and get you onto the previews and the GA releases. The other aspect of this is, what does Copilot mean as far as an adoption standpoint? Can I sort of test out and play around with Copilots, especially with some of those sort of business application scenarios? Or do I have to deploy this out to my whole organization and all of my users? The answer is that we can define a certain subset or trial group and then experiment and explore how that works and then slowly roll it out as we see fit. Okay. I think we've touched on data security quite a bit. So again, data security is front and center from Microsoft's standpoint. The data that Copilot is using for a number of the scenarios that we showed, not available to Microsoft, not available to other customers. Microsoft isn't using your data to just train the AI as well. So there's some restrictions that Microsoft has in place so that does not happen. And then how you're using Copilot and the prompts that you're using are also not shared with Microsoft. So if you ask questions of Copilot, that's all sensitive information that Microsoft is ensuring stays within your organization. Okay. That's a pretty broad topic. We're happy to dive very much more deeper around how Copilot and AI is secured by Microsoft. And then to wrap up, I'll hand it off to Jordan.
You've been very easy on us in the Q&A and chat, everybody. So thanks for that. If you do have any other questions, as we've said throughout, feel free to reach out to any of the Velrada folks on this call, your usual point of contact at either Velrada or Microsoft. And look, if you're an existing Dynamics customer, these capabilities are available for you to access in preview at the moment and coming through thick and fast to Australia. If from a Power Platform point of view, there's a whole swathe of these that are ready and generally available for you to access. Some restrictions around where we can make them available. But again, if you're interested, please do reach out and we'll work through it with you. And if you don't have either, but this is exciting to you, please do reach out, because there's a heap of opportunity for you to get started with Dynamics and the Power Platform, and of course all of these Copilot features. If there's anything that we can do, you know where we are. Feel free to reach out, and hopefully you can get started in this journey sooner rather than later. The age of AI, I think it really is now, and these features are genuinely here. They genuinely work. They're super easy for us to enable for you. And so the key is to really start thinking about how you can leverage it and taking the plunge into weaving this into the tapestry of your business application.